Jeopardy, we'll talk about like our skin, right? So we talked about chapter 19 last week. We also introduced nervous system diseases. So we talked about meningococcal meningitis, which is the worst type of meningitis. Do you guys remember who the etiologic agent was? Yes, Neisseria meningitis.
Yeah.
Okay, so do you guys remember why Neisseria specifically was so much worse than all of the others that cause meningitis? Think about the cell wall structure. Is this a gram-negative or gram-positive? It's a gram-negative. And then, so if it's a gram-negative, it has what on it, on the cell membrane? What's the characteristics of gram-negative bacteria? What do they have on there? So they got two cell membranes, right? Outer, inner. They have periplasmic space, right? And then what else they got? LPS, lipopolysaccharide, or lipid A, right? So whenever you're killing a gram-negative, what happens to that LPS? It gets released, right? That's what causes fever and can cause shock. And specifically with Neisseria, it's not only a gram-negative, but this is a special type of gram-negative, where it makes like 1,000 times more LPS than a typical gram-negative, okay? Is it as common to get? No. So we talked about the 3 different types, right? So we talked about different types of bacteria can cause meningitis, fungi can cause meningitis, viruses can cause meningitis. That's just inflammation of the meninges. But when you think about which one is the worst to get, Neisseria is the worst one to get, right? So why? Because of structure, right? And then how did you get this? Do you guys remember? What was the transmission? Yes, ma'am. I heard it. Yes, droplet, right? So when are you gonna get this? This is secretions, right? It's droplet. Typically you're gonna get it when you're in close contact with other people. So a lot of times it's gonna be your dorm mate, right? Or if you're in the military, this is gonna be, many people live in close proximity together. And who's gonna be the ones carrying or passing this disease on to others? It's the carriers, right? We said 10% of people carry this in their nares. And so you're always gonna see these pop up. But what can we do for treatment? It's a bacteria. We also have a vaccine. We do have a vaccine, it's the MenV vaccine. So if you're gonna go live in a dorm or military or anything like that, you can take the MenV vaccine. Treatment's gonna involve antibiotics though. And just know if you have a gram-negative, you're gonna go worse before you go better, right? Okay. Tetanus. So tetanus is caused by Clostridium tetani. And with tetanus, this is a gram-positive, it forms a spore. So how did you contract tetanus? What did you have to do to get it? Yes, a puncture wound. So you get a puncture wound, so you get that spore into a place where there's no oxygen, right? And then what is that? It's gonna start to release the toxin. It turns into the vegetative state. It makes a toxin. And then what does that toxin do? Do you guys remember? What does tetanus cause?
Oh, it's like something with your
Spasm, April, spasm. I thought you said spasm, but it was April. You spasm to death, right? So you're contracting because this toxin is binding to the acetylcholine receptors and saying contract, and you never relax, right? That's when you see that boweled back. Yeah, right? And for tetanus, what is your treatment? How are you gonna treat someone that has tetanus?
A shot.
This is our trifecta. So you need antitoxin first, right, to bind up the toxin. Then you need antibiotics, so we can kill the Clostridium. And then 3, we're gonna vaccinate, right? Because it takes just a little bit amount to cause a lot of effect. So typically, when you get tetanus, you're not causing enough of an immune response to have antibodies for next time. Okay? And what type of vaccine is tetanus? Tdap, and it is toxoid. Right? It's a toxoid. So they're giving you inactivated toxin. Clostridium botulinum. Okay, so this is another, again, still gram-positive spore former. For botulism, how did you get botulism? The severe one, right? How'd you get that? What'd you have to do? You eat it, right? This is the canned green beans, right? Our senior picnic, right? Don't can vegetables at home, because you're gonna consume the spores, right? What ends up happening with this toxin though? What does this toxin do? Yes, too much relaxing. Okay, so it binds and it prevents acetylcholine from being released. If acetylcholine is never released, it never binds to the receptor, you never get your muscle contraction. So this one is relaxed. So this one you're gonna see things like the blurred vision, right? Flaccid paralysis, droopy face, right? So this one's the complete opposite. And how are we going to treat? What do we gotta do? Yes, antibiotics and antitoxin. You gotta bind up that toxin first, right? Then antibiotic. Leprosy. Okay, so leprosy, this is the last one we talked about. We'll just talk about that one more time. Okay, leprosy. They're moving more forward to calling it Hansen's disease now instead of leprosy. So Hansen's disease, this is caused by Mycobacterium leprae. So this is the type of bacteria that has a waxy cell wall. So it's not gram-negative and it's not gram-positive staining, right? It's acid-fast staining. With Mycobacterium leprosy, what it does is it gets into your peripheral nervous system and it starts to replicate in your peripheral nerves. And then it travels to places where it's typically cooler. So it doesn't really like 37 degrees, which is our internal body temperature. It likes a little bit colder. So it likes, for example, fingertips, nose, ears. So a bit of a cooler environment. That's also partially why we grow it in armadillos. Second piece to that is that the incubation period is really long, so 2 to 5 years. So that's also why it's so difficult to grow in the lab. So you can be infected with it and not actually show any signs or symptoms until 5 years later. Okay. As it starts to replicate, it can survive phagocytosis, it replicates in your cells, and then what it does to your nerve cells is, as it replicates, your immune system tries to basically get rid of the pathogen, and when it gets rid of the pathogen, it starts to think that your cells are the mycobacterium because it's replicating inside your cell. So then you end up getting a little bit of an autoimmune towards the end. So it's your own cells killing your own cells. But you don't die from Hansen's disease. It's just uncomfortable, and it can lead to deformations, but you don't die, okay? This is two different forms of the leprosy. So they have tuberculoid. So in this one, your immune system is doing a really good job at responding. And in that little ring area, you've kind of become numb, but your immune system really locked it down. The more extreme version is leprotomus, which is, that's when you start to see those nodules and deformations on the fingertips. So again, typically fingertips and ears, nose, just because they are cooler compared to the rest of the body. Okay. Again, very slow progression. The tuberculoid is going to be 2 to 5 years, and the more progressive form is going to be 9 to 12 years. So can you go 12 years without knowing? Yeah. Okay. But usually, in order to get infected from somebody who has Hansen's disease, you really have to be living in very close proximity with them, because their nasal secretions have to get in your nasal secretions. So you have to be like living together with each other for a long period of time. If someone comes into the hospital, you have your PPE on, like, you're fine, you're not gonna get from them, right? It's if you're at home living with them, you know, where then you can transmit. When we think about treatment, we don't have the treatment. There was a vaccine, but it did not work very well, so we don't use it. And the vaccine doesn't really work well. You can give some antibiotics, but it's kind of about it. And you can just, best thing we can do is some antibiotics. Vaccine, we don't really have one for it. You do find this more in tropical areas. So tropical areas is where you see this bacteria. Yes?
Can you give the tuberculoid one and then develop into the more progressive one?
If your immune system can't handle it, then it can go to the more progressive. But don't go to tropical areas. Wow. I still go to tropical areas. Not all the time though. Like, once in a while. Okay, 2 more. These guys are viruses. Okay, we're gonna talk about poliovirus and rabies. Okay. Polio. Okay, so polio, usually diarrhea, but there is a 1% that can lead to paralysis. Okay. Typically, yeah, again, it's only 1%, but we're gonna care about that 1%, and we don't want people to get polio. Okay. So polio first appeared. It's actually kind of interesting because polio first arose because we cleaned up the neighborhood. Okay, we cleaned up. So think of like in the streets in the old days, right? You just had like people throw their trash out in their front door. Water was dirty, and we made a really good point in 1894 to start cleaning up our cities, right? Which is a good thing. You want to clean your water, you want to clean your area, but it was so clean that as an infant, while you were being protected by mom's antibodies, you never encountered polio. So when you encountered polio as an adolescent or as an adult, you got really sick. So it was actually a good thing to be introduced to polio at a young age when you were still being like breastfed or taken care of with mom's antibodies. This is weird, right? Why would cleaning something up all of a sudden be a problem, right? This was just a weird situation, right? So we were too clean, all of a sudden people are getting sick of this, okay? Because we had never seen it before. Okay. How do you get polio? This is fecal oral route, okay? So you had to ingest contaminated water, or water that had been contaminated with feces, right? So fecal oral. Once it gets inside, it goes to the lymph. Lymph goes to the blood, and in most cases causes like severe diarrhea. But we do have that 1% that can lead to central nervous system infection and cause paralysis and death due to paralysis of respiratory muscles. So it's only 1% that this can happen, but we care about that 1%. So we introduced a vaccine, okay? So there's 2 different types of vaccines for polio. We have Salk and we have Sabin. Salk has a K, so this is gonna be the killed one, right? Salk, you're gonna get an injection, 90% effective against the paralytic polio. So, great job, right? There's also Sabin. So Sabin is going to be the live virus. So for the live virus, this is something that you ingest. So it mimics having a real infection, right? What happens though with Sabin is it was easy to administer. It was cheaper than a vaccine. But with Sabin, the issue is that if you take the Sabin vaccine, right, and you shed that live virus, can you infect someone else in your home? Yes. Okay, so it's not the best scenario because you can infect other people in your family that you don't mean to. So we don't love that. So we're gonna go towards using salt. Okay. Okay. So here's what happened with the Sabin, right? So the first dose worked, and then what happens when you give something that's live? Can it go virulent? Yeah. Okay. And it didn't even have to be virulent for you to be infecting other people in your household. So those are the few controversies associated with Sabin and why we don't recommend using Sabin. However, if there is a large outbreak, Sabin would be the way to go because you would get a strong immune reaction to get the antibodies needed to take out that virus. Okay. But we're not gonna aim to use this one first. We're gonna aim to use the salt instead. Okay. So here's what happened. So first, in the 50s, cases arose due to being too clean, right? Then we introduced salt, right? Salt is the killed one. Cases start to go down, right? And then what happened here? Cases went up again. So what happened was Berkeley was in charge of administering the Salk vaccines. Berkeley forgot to inactivate, or they forgot to kill the virus in the vaccine. So they gave a bunch of people polio. They forgot. I don't know who's in charge, but they forgot to kill it. Yikes. Okay? So that increased the amount of polio, right? increase the amount of cases. When that happened, what are they gonna do? Boom, Sabin, right? They introduced Sabin, plummeted, right? Took all the cases down. Then they stopped giving Sabin and they started doing Salk again, okay? And at this point, cases are steadily going down. You do have random little outbreaks, but nothing like this, right? That's when I believe the government stepped in and started being in charge of who was administering these vaccines, protocols, all of that good stuff. But yeah, what happened there, they forgot to kill the virus. So, yeah, that's a big part. Yeah. Now, you don't really see it. Okay, that's polio. So typically, again, usually more mild, but we care because it can lead to an attack your central nervous system and cause paralysis and death. Okay. In that 1%. Okay, that's polio. Next one is rabies. Okay, rabies virus. So different animals can carry rabies. Here in California, well, just in general, it's a lot of our bats. A lot of our bats have it. Some dogs can have it, but usually most dogs get vaccinated. Squirrels can carry rabies. If an animal is foaming at the mouth, that's rabies. Okay. That animal is typically going to bite you, right? When it bites you, the saliva, which has the virus, comes into contact with the peripheral nervous system. Okay, gets into the peripheral nervous system, goes all the way up central nervous system, right, straight to the brain. Okay. Okay. With rabies, it can go south kind of quickly. So when you first get rabies, what you're gonna see is bipolar characteristics, spasms of the mouth. So, and Frank's response to liquids or hydrophobia. So you're like afraid of water, okay? Which can then develop into furious rabies. So this person is gonna be relentless. They'll try to bite you. Eventually paralysis because swallowing becomes difficult and it becomes fatal within days. So this person literally went rabid, right? The only way we can diagnose you is looking into your brain. So we'll only know if you had it officially when you're dead and we open up your brain and look in there, right? Treatment, okay. It depends when you catch it. It depends when you catch it. If you're in furious rabies, we don't have anything for you, okay? Only when they first pop, can we help you? If you're trying to bite people, it's too late. We have nothing. There's nothing we can do. There's nothing we can do. I know, it's super bad. Okay. That was an ugly no. But if something is foaming at the mouth and it bites you, go to the hospital. Go to the hospital, right? Okay. Good PSA, okay?
Don't try to set me
No. I was afraid because last year I went to an area and there were bats and I didn't realize that there was gonna be bats until there was no place to turn. And then I was like, I can only proceed forward, and proceeding forward were the bats. So I was just like, I really hope I don't get bitten right now. I don't know what I'm gonna do with myself, but I just like held my breath and made my way through, and I survived. But had I known there were gonna be bats, I don't know if I would have done it. But it's okay. We made it. There was nothing there, but I did, like, my life flashed before my eyes. I was like, oh my god, I have to pass by bats right now. Oh, I was holding my breath. It was really bad. It was, it's because I went to Escaret, and I was on, like, the river part, and there's a cave part that you go under, but I didn't know there was gonna be bats under the cave. Like, this is like, I don't know. I wasn't expecting there to be bats. So, yeah. But I couldn't get out. You couldn't go back. Yeah, just, but it's okay.
There's bats at CCD at night.
But I'm not roaming around CSCB at night. So, no thank you. No thank you. Okay. That was nervous system. So we talked about 4 different bacteria and 2 viruses. That was it, right? Nervous system. Okay, now we're gonna move on to some cardiovascular and lymphatic stuff. We'll start with cardiovascular first. Okay, so why do you need your cardiovascular system? What is the cardiovascular system?
Your heart.
Delivery system for oxygen.
Yeah, right. It's your blood. What's in your blood? Red blood cells. What do?
Deliver
Oxygen to your tissues. What happens if you don't get oxygen to the tissues? They die. Yes. Thank you. It's important, right? Oh, flashbacks. Superior, inferior vena cava. To the right atrium, right? Yeah, yes. I'm not gonna ask you. But I mean, we did it, right? It's okay. I'm not gonna ask you the pathway of blood. I assume you know it.
You had a little too much pleasure with that.
Yeah. That was good. That's not bad. We got this? No, I'm not gonna ask you that. This is just a reminder, right? Okay, what's part of your cardiovascular system is gonna be the blood. So we're gonna be talking about things that get into the blood that can attack what? Your heart, right? Yeah, like that's the box. Okay, so your heart, you have the pericardium, myocardium, and endocardium, right? We're gonna be talking about different types of, I'm not gonna test you where they're at, but this is just for reference, right? When they attack myocardium, what does that mean, right? We're attacking the muscle of the heart, okay? Is that gonna be bad? Yes, right? If you attack the lining, right, the pericardium, is that bad? Yes. Endocardium, that's the inside of the heart, so bad, okay? But I'm not gonna throw that diagram out there and say label the pieces, okay? We did that already. We did that. Okay. Should blood have bacteria in it? No, it should be sterile, right? Ways that blood can be contaminated, like a trauma, right, an incident, needle poke, right, surgery, a bite, right? Blood is not the best environment for bacterial growth, just because we have not a lot of iron available. We bind up all the iron so that bacteria can't use it as a source of nutrition to replicate. We do have phagocytes, right? We have phagocytes patrolling. We have antibodies. We have complement components in the blood, right? We have T lymphocytes. So you shouldn't be getting an infection in the blood. However, what happens if red blood cells are being killed during an infection? Bad, right? We just said we need our red blood cells. For what?
Oxygen.
Deliver oxygen to the tissues. Yes, okay. So, if you have a bacteria that replicates and then exits the red blood cell, It can get, if it's killing the red blood cell, then it can get access to resources, and it can use that cardiovascular highway, blood vessels, to get a straight one-way ticket to the heart, right? Which is where we don't want it to go. Okay, sepsis. Sepsis is toxic inflammation. Septicemia, this is when you have uncontrolled growth of bacteria in the blood, and then lymphogenesis, so inflammation of the lymphatics, okay? Okay. So if your immune system can't combat an infection, what can happen? Sepsis, okay? What happens during sepsis? Fever, chills, hyperventilation, accelerated heart rate. Sepsis can turn severe, so a drop in the blood pressure, which causes that shock, and this is where you can start to have organs fail, okay? Which can lead to septic shock, and then that's gonna be multiple organ failure, and then death is very high, right? When multiple organs start failing, that can be fatal very quickly. Usually during sepsis, you can give antibiotics. Once you hit septic shock though, it's already bad. It's pretty bad. We can give you antibiotics, but if we kill a gram-negative and you're already in septic shock, is your patient gonna get better? I don't know. We're still gonna give antibiotics though. You're still gonna treat your patient, but I don't know, right? We'll see what happens to our patient. So gram-negative sepsis is gonna be way worse. Why? What's on a gram-negative again?
LPS.
Yes, right. What can we treat with? Antibiotics. That's it. Not very effective, right? We're not gonna go for that one. You can have sepsis from a gram-positive. We just don't 100% understand how this specifically works, but it's mainly gonna be enterococci species. So Enterococcus faecalis, those are gonna be your bigger ones. We can give vancomycin, right? Vancomycin, that's like our big dog, right? For gram-positives. So it can happen from gram-positive, we just don't know 100%. What can we give? Vancomycin. So antibiotics, right? We'll keep it general, antibiotic, vaccine, antitoxin. Yeah. Okay, group B, streptococci, okay? Group A, do you guys remember who group A was? Who's group A streptococci?
Flesh eating?
Yes, which is?
Like the necrosis?
Yes, and what is the genus species? You're right though, it is flesh eating, it is a necrosis.
Step.
Oh,
You mean
strep
Staph aureus?
It's Streptococcus
Streptococcus.
pyogenes.
Oh.
Pyogenes, that's gonna be group A, okay, that's your flesh eating and impetigo, okay, that's group A. Group B is Streptococcus agalactiae, okay? Streptococcus agalactiae, this can cause neonatal sepsis. So many women can carry group B streptococci in the vagina, and so at time of delivery, the baby can come into contact with group B, right, with agalactiae. What they can do though is you'll typically get tested to see if you carry strep B, and if you do, we give antibiotics before birth, right, to limit exposure, and so baby never gets contaminated and doesn't cause neonatal sepsis. Okay. So 7 to 10 days before birth, they'll give you an antibiotic. That's only if you carry it. If you don't carry it, then, yeah, one less thing to worry about. Okay, next we're gonna talk about 5 different bacteria and 2 viruses. So we'll talk about rheumatic fever, endocarditis, anthrax, Lyme disease, bubonic plague. We've already talked about Lyme disease, that one's a review, right? We've already talked about bubonic plague, that one's review. Burkitt's lymphoma and viral hemorrhagic diseases, those will be a little bit new. We talked a little bit about Burkitt's and mononucleosis, so that's like half review, okay? So rheumatic fever. Rheumatic fever is caused by Streptococcus pyogenes, okay? So what happens is you get strep throat, which is caused by Streptococcus pyogenes, but let's say you don't get treatment for Streptococcus pyogenes and you don't kill the bacteria. Your immune system will gobble it up and make antibodies for Streptococcus pyogenes. However, when it does that, some of the antibodies like to recognize your own cells, specifically your heart cells. Okay, so once that happens, they start to specifically damage and attack your heart. So you end up, it's an autoimmune, right? But it's because of the bacteria that was untreated, you formed antibodies, and towards the end, it's an autoimmune, right? It's your antibodies attacking your heart cells, which is why it's important if you have strep throat, get your antibiotics. And we're gonna take them the whole time, right? We're not gonna stop taking them early, right? Right? Because what happens? What happens if you stop taking them early? Yes, beautiful. Okay, so what happens? You're gonna have a macrophage phagocytize the bacteria, okay? Strep pyogenes. The macrophage is gonna present it to a T helper cell, right? And then what does that T helper cell, who can it show this information to? Who makes antibodies? B cell, right? And if it's activating a B cell, is it T helper 1 or T helper 2? T helper 2, okay? It shows it to the B cell, activates it, and then the B cell is gonna make plasma cells, which secrete antibodies for Strep pyogenes, and it's gonna make memory cells, right? Because T helper was involved, so it's a T dependent, so we do make memory, okay? And the antibody is for recognizing that M protein, right? M protein, which is unique to Strep pyogenes. But here's the bad part. Some of those antibodies are gonna recognize your myocardium. Isn't that wonderful? Love that, okay? Now you have inflammation. These cytokines or chemical messengers for your immune system are gonna be released, and we're gonna start to attack your myocardium. So the muscle layer of your heart, which is, right, now I went autoimmune, right? So now it's an autoimmune condition. And that's what's called rheumatic fever, okay? Rheumatic fever. Which started as just strep throat, okay? So if you ever think that you have strep throat, so you open your mouth, you can see white, strep throat. What do you do? Get antibiotics. Okay. Always, always, always get antibiotics for strep pyogenes. Okay. Over time, leading to tissue damage, damages your aorta. What are we gonna do? Finish your antibiotics. Okay. Okay. If not, you're promoting resistance. Okay. Are we okay with rheumatic fever? So you think you have strep throat, we're gonna treat it. Okay. Question? No. Okay, so back to the structure of the heart. So rheumatic fever was the myocardium, right? Okay. Endocarditis, so this is the inner layer of your heart. Okay, inflammation. That's the bad thing, right? You don't want too much inflammation in the heart, because too much inflammation is going to damage those cells. Okay. What can happen is endocarditis can be acute, so fatal within a few days, or subacute, which will be chronic, right? But chronic is still bad because chronic leads to tissue damage over time. Two different ways, or two big main ways that you get endocarditis. A lot of times it's going to be your own bacteria, right? When you go into the dentist for a routine cleaning and one of your own flora from your mouth get into your bloodstream. As we'll see tomorrow, a lot of us carry alpha strep in our mouth, and that's normal. But if that alpha strep gets into the bloodstream, that can cause subacute bacterial endocarditis. Okay? Fever, general weakness can lead to heart murmurs. Again, this is going to be alpha hemolytic, so alpha strep. Another way that you can get these is during tonsillectomy, right? As they're removing your tonsils, that can also be, you can introduce the bacteria into the bloodstream. Sometimes with piercings, so like with a tongue piercing, you can introduce the bacteria that way. The other form is it can be good old Staph aureus. Okay, Staph aureus is going to cause the acute bacterial endocarditis, and this is the bad one. Okay, so subacute, it'd be yourself, and then acute, that's the bad one. That's Staph aureus. Progression, so disease or deformed heart valve, clots start to form, accumulate, and then you have this nasty biofilm form. When you have a large biofilm start to form, you have to be more aggressive with your antibiotics, right? Because now you don't not only have to kill the bacteria, but you have to get through this thick wall of sugar, okay? So if you have this thick, your valves are helping prevent backflow of blood, right? That's why they're there, so they can only go in one direction and can't go the opposite way. Once these get clotted up, then you can have backflow, right? Which is not what we want. Your blood should not be able to go in both directions, right? It's supposed to just pump one way, open, close, one way, open, close. If you have distraughted that, then blood can flow back up, right? We're gonna have to do high dose antibiotics, okay, in order to treat those biofilms. High dose, IV, right, straight to the blood. It's like, kick it up, like, turn the volume all the way up, right? You wanna be aggressive with this one. We can give penicillin or vancomycin. Again, I won't be picky about penicillin or vancomycin. I'm looking for high dose antibiotics. High dose antibiotics. Okay. I'm gonna be aggressive with that one. Okay. How do we feel about alpha strep or Staph aureus? Right, can cause endocarditis. Staph and strep do a lot of damage. Subacute. Subacute and acute is Staph aureus. Aureus is acute. Staph aureus. So Staph aureus is worse, right? Because Staph aureus has what hemolytic properties?
Beta
Beta hemolysis. Alpha strep does what? Alpha hemolysis. So what's worse? Beta. So beta is going to be your acute. Alpha strep is going to be your subacute. Boom. Yeah? Yeah. Yep. It's in the name. It's in the name. And then acute is aureus.
Beta.
Staph aureus is acute. And see? Okay, anthrax. So anthrax, this is review 2. We've talked about anthrax. You can get anthrax in different ways, right? There's the cutaneous, so the skin one. This is gonna be when you're working with animals. Yeah, this is a little review, right? You also have the inhalation one. That's the really bad one. That was the word throughout the White House with the envelope, but that typically doesn't happen, right? That's not normal. And then there's the intestinal anthrax, so that's when you consumed it, okay? Super rare too. The one typically, this is Bacillus anthracis, right? So this is another gram-positive. It does form endospores, right? Remember who are the 2 genuses that can form endospores? Clostridium and Bacillus, right? Those are the 2 that do endospores exclusively, okay? For cutaneous anthrax, so these are people that are working with cattle. It's very common, but, well, not common, but it's easier to get. But what we do is we vaccinate the cattle. No, and we can vaccinate you. If you work with a lot of cattle, you can have the vaccine. It's the most common, but typically cases are fever, malaise, and skin lesions, and the bacteria doesn't go into the bloodstream. So, are these a little nasty? Yes, but we got a vaccine for you if you're working with cattle and with animals, so you don't have to worry about it. Yeah. So that's cutaneous anthrax. So it's just on the skin, doesn't get into the blood, right? Doesn't go to the heart, just on the skin. Okay. Inhalation though, this is a scary one, but it's not gonna be you. This is like if they do like some crazy warfare and they like do something crazy. But it's okay, Probably not gonna happen, right? So this is that situation that happened at the White House, right? They had all the spores and you inhaled a bunch of spores, okay? So early symptoms, fever, coughing, chest pain. At this point, antibiotics will do the trick, okay? If you wait 2 to 3 days though, septic shock. Okay. At that point, too late, right? Remember we said antibiotics don't really work for you once you got into septic shock because you're already at multiple organ failure, right? Okay. And then in 24 to 36 hours from septic shock, death. That's only if you inhale a bunch of spores. And that's not realistic unless like biological warfare, you know? Like, I'm not selling that. I'm not selling that you have to go home not worry about this. Okay. 100% fatal. But that shouldn't be you though, because you shouldn't be inhaling a bunch of spores, but just so you know, that's why we care about it, okay? That's why we care about it. Okay. Okay. Bacillus anthracis, why it's lethal, it has 3 different toxins. Okay, it has edema factor and lethal factor. Edema factor causes edema, right? Swelling. Okay, you know that one. Okay. And then lethal factor, what do you think that does? Kill, right? So it kills macrophages. So here's the thing. Edema factor and lethal factor alone, those exotoxins don't really do anything. They have to be activated. So when there's presence of protective antigen, edema factor plus protective antigen turn it into edema toxin. Okay? Lethal factor plus protective antigen turns it into lethal toxin. So that protective antigen is really a key into activating these toxins, okay? So what do you think we do for a vaccine? What are we gonna target? Yes, target protective antigen, okay? Yes, exactly. Because if protective antigen never comes into contact with edema factor or lethal factor, it's not activated. Aha. Aha. Got you. Okay. Okay. Diagnosis is going to be isolation culturing. You could do a blood test. Prevention. You can do prophylactic antibiotics if you're exposed because it's a bacteria. If you're working with livestock, vaccination, right? Humans, we don't use that one. I don't think it works very properly. There's a problem with it, with that vaccine.
Isn't the oil make a vaccine for humans?
I don't know, because how do you, I feel like the issue with prions is that it's your own protein. So how can you distinguish like your own protein from, I mean, I'm sure they gotta invent something. They gotta do, I mean, I'm sure there's different ways. I see what makes it difficult to do so, but they'd have to, right? Cause then what if there's a protein that is starting to fold and you're destroying it because it's not correctly folded together, but maybe it was just developing, right? So, I feel like that's a hard one. You'd have to find like a specific marker. They'd have to find a specific marker or characteristic that's in a prion that is not found in a functional protein. Once they find that marker, then you can use that as a target. And whatever vector we use to target it will be like another stage. But the first problem would just be, how can I tell the difference between functional versus non-functional, right? Like, is there some sort of marker on there, right? Is something myelinated or, you know, some sort of like sequence or some way that I can tag this one versus that one. That'd be interesting though. That'd be pretty cool. Just because it can be common, you know what I mean? And we don't have anything for that. It's interesting. Like, can we look at that? But you could get it through ingestion. Inhalation and ingestion, not common. Inhalation, the worst one to get. That's the one that you die. The common one is going to be cutaneous, but you don't die from that. And we got a vaccine for that, so we're not worried about that. Yeah. Okay, Lyme disease. This one's review, right? We talked about Lyme disease and parasites. So Lyme disease, who is transmitting the disease? It's the tick, right? And the tick is carrying the bacteria, Borrelia burgdorferi. Where are you gonna get this guy? Typically like hiking, right? Like if you're hiking in like woodsy areas, you can get this tick. That's why you gotta tuck your hands into your boots, right? Pull your socks all the way up. Make sure you don't got a tick biting you, okay? Transmission, 2 to 3 days. Okay, there are increasing cases of Lyme disease, but when we talk about it, we think that cases are increasing just because now we know what it is. So Lyme disease can be difficult to ID or diagnose. So we think that cases have risen just because now we know what it is, versus, oh, now we have like so many ticks carrying Lyme disease. I think we just didn't know what it was. And so the amount of reported cases are higher because of that. Or it could be some sort of ecosystem change. Okay. Where do you mainly find these guys? East Coast. Mainly on the East Coast, right? And in the East Coast, it's gonna be deer. Deer and mice who carry it. Us on the West Coast, I mean, we do get some cases. What's that trail right there in between California and Nevada? Does anyone know what?
Tahoe?
What's that?
Isn't it like the Tahoe maybe?
I don't know.
The green? I think that's Tahoe.
Is it?
Yeah.
Is it Tahoe? Okay, so Tahoe. Took your fancy. Okay. What's interesting is that in the West Coast, it's not the deer and the mice, it's actually lizards. A lot of lizards carry it, which is kind of interesting. So definitely ecosystem, but mainly where it's hot is the East Coast. But you can find some, I guess, in Tahoe right there. Okay. Or, yeah, not that many, but Northern California. Not very much here, but yeah, usually it's gonna be those two coasts, those foresty places. What does it look like? First, you're gonna see a rash, okay? That's phase 1. So you're gonna have flu-like symptoms, okay? Then your rash fades, right? You can get antibiotics, perfectly fine, very effective. It's a bacteria, okay? But if you did not get treatment 1 to 2 weeks, so if you go on a hike and you see this, what are we gonna do? Antibiotics, yes, okay. If you see this develop and you ignore it for 1 to 2 weeks and you don't get treatment, then you can go into phase 2. So irregular heartbeat, chronological, neurological symptoms, spastic paralysis, meningitis, encephalitis. At this point, it can progress into phase 3, months or years later, and you're dealing with chronic arthritis, okay? So a lot of times it's difficult because once this rash goes away, they don't really know, okay, you have flu-like symptoms, well, what can that be, right? So pay attention to, right, where you've been. Have you been into these hotspot areas, right? Check your body, right? Okay. So diagnosis is going to be the rash. Prevalence, so where were you, what were you doing? Because clinical ID tests don't really work very well. That's why it's kind of hard to diagnose. So remember where you were, what you were doing, pay attention to your body. Antibiotics, vaccine, there you go, it doesn't work very well. So they developed the vaccine, but it's unsafe, can cause autoimmune disease, and it's ineffective. So vaccine, cross out. You got no vaccine. What we do is antibiotics. And it works best in stage 1. Stage 1. Questions? Lyme disease. What about Lyme disease? Okay. Let me give your quizzes back. Okay? We'll talk about bubonic plague afterwards. Yeah? Okay. Let me give you your quizzes.